Recovering after a first-of-its-kind face transplant surgery. 37-year-old Richard Lee Norris was shot in the face in 1997. He lost most of his upper and lower jaws, and he's pretty much lived a life as a recluse until his dramatic surgery 7 months ago. It's an incredible transformation, but I want to warn you that some of these pictures could be a little tough to look at. Let me show you Richard before the shooting. Now an image of him before the surgery. Remember, he spent about 15 years of his life like this. Here's Richard less than a week after the operation. And here's the big one. Look at that. Just a few days ago, 114 days after his surgery. Let's talk about how he's doing. We're going to check in with his surgeon now. Dr. Eduardo Rodriguez, he's the chief of plastic surgery at the University of Maryland Medical Center. Wow. Pretty remarkable to see those pictures. Very inspiring. Tell us how Richard is doing now, doctor.
Well, he's doing great. He continues to improve every day. He's met every milestone that we've set up for him, and he's actually exceeded our expectations. His function is improving dramatically. The animation of his face is amazing. He has about 80% recovery on the right side of his face, approximately 40 to 45% on the left. He can open his mouth about 2 inches. He's chewing. He's no longer requiring nutrition through his feeding tube. Really an amazing recovery.
I mean, and it's such an incredible transformation. I mean, talk about how this recovery process, what it's been like. Like, how's he expressing himself, and you know, kind of give us the inside moment there when you're together as you've been going through this.
Well, just seeing him, as I've always said, it's still a surreal experience. I stare at him, and it's truly amazing. But I'll tell you, Richard is a remarkable patient. He's worked very hard. He's participated aggressively in his speech therapy, his physical therapy. He constantly looks at the mirror so he can see his facial expression become more normal. He's an amazing patient. He does everything that we ask him to do and more. But it's amazing to look at him. It's the most remarkable thing that I've ever seen.
I'm sure his heart is singing. Well, this is the first time a surgery like this has been done. What an undertaking for both of you. And then just replacing the jaws and the teeth and the tongue and the skin, not to mention nerve and muscle tissue. So how did you even come up with a plan to tackle this?
Well, Richard had his severe deformity, and unfortunately, from all the surgeries that many surgeons have performed, including myself, to try to normalize his appearance and his function, we kept hurting him. If you looked at some of the scars on his forehead, those were not a result of his surgery, but a result of his injury, but as a result of our surgeries. So to try to make Richard appear normal, we had to extend the boundaries beyond the facial injury, and we had to ensure that we completely reconstructed the deformity, and that's why he needed the bones of the upper and lower jaws, the teeth. He had to eat normally. He hadn't done that in 15 years. He had to speak. He was missing a portion of his tongue, so the surgery would have to replace all the missing parts, which is what we set out to do. This surgery had to be transformational, and it was the only way Richard could be normalized. And we practiced extensively for many, many months, and we achieved everything that we set out to do without a hiccup. And thankfully, Richard has done remarkably well, better than we ever expected. It's amazing to see his recovery. Every day he improves. His speech continues to get sharpened. His ability to eat and continually improves. So now that we're seeing him only once or twice a month, every time I see him, you could see how he's advancing as far as his recovery. It's truly remarkable.
Well,
and to see what's going on with him psychologically.
Oh, yeah.
You know, he lived behind a mask.
Right, and just
not anymore.
A hermit for 15 years, no, and he just really, he looks so handsome, and it probably makes him feel so good to hear that as well when people say, you look so handsome.